Good evening, friends. I am Dr. Sunil Prakash. I am Senior Director and Head of Nephrology and Kidney Transplant Service at BLK Max New Delhi as well as Max Gurgaon Hospital. Today we will be talking about a very common symptom which is pedal edema. What it basically means is swelling over feet. Sometimes people suffer from these symptoms and it is important to know its causes. This symptom can occur due to many reasons. So first, what is pedal edema? Pedal edema is when your legs, especially if they are kept downward for a long time, they become swollen, they may become shiny, and if you press them on your shin, there will be a pitting, there will be a gadda there. So you can understand that this is water and not fat. In a very fat person, if they press, there will not be a clear-cut pitting because fat will not give way, whereas water will give way. So if somebody is having a gadda or a pitting on his shin, then they must suspect pedal edema. This pedal edema may also be associated with swelling under the eyelids, which is called puffiness, and with some other symptoms and signs. It is important to understand what are the causes of this pedal edema. Pedal edema, friends, occur most of the time due to kidney involvement. And why is that? Because kidneys are responsible for throwing out excess salt and water which we consume. So if our kidneys are not functioning well, we will not be able to throw out all the water and salt, and that will accumulate in our body. Once the water accumulates in our body, so when we are sitting or standing for a long time, the swelling will come on our feet. Because we know the water will go to the most dependent downward position. That is why you have pedal edema. Common cause of kidney involvement are kidney failure, whether it is acute kidney failure cause acute kidney injury or chronic kidney disease which is there for a long time. And sometimes, especially in young children, they may be passing lot of protein in their urine because their kidney permeable holes through which the urine comes out becomes bigger and loses their charges, so lot of protein of the blood filters out. So they will have lot of protein in their albumin in their urine and their blood becomes thinner because albumin is a very strong binding agent. So when the albumin is lost, their blood becomes thinner and they get pedal edema or swelling on their feet. So this is called nephrotic syndrome in children. It is associated with swelling on feet, passing of protein in the urine, and because lot of protein is lost, the liver will make that excess protein and in the process it makes more cholesterol also. So even young children sometimes can have very high cholesterol. So common causes will be nephrotic syndrome and renal failure. Besides, we must not forget heart conditions like congestive cardiac failure. In congestive cardiac failure also, because the heart is not able to pump the blood forwards, the blood gets staggered in the back and you have pedal edema. And sometimes in very bad liver conditions, chronic liver disease also, you will have swelling. So these are the common causes of swelling. But as I said earlier, pedal edema, whether it is transient, whether it was present in the past for some time or whether it is present for a long time in the present illness is very important, and kidney diseases are mostly responsible. So we must understand what are kidney diseases. It is very, very important to understand the early symptoms of kidney diseases. Friends, paradoxically, when the kidneys are becoming sick, they produce more urine. It may sound quixotic and paradoxic, but it is true. So if somebody is passing more urine, especially urine at night, has frothing because of protein in the urine which we have already discussed, or has low hemoglobin, or has body pains, and very, very important, they may have high blood pressure. Young people, you know, should not have high blood pressure, but if young people are having high blood pressure or they are getting swelling over their feet, whether this swelling is temporary or permanent is a different matter. But if somebody is having swelling over feet, is having high blood pressure, and if young people are not able to father or mother a family, they are not able to conceive, kidney disease are very, very important to be considered and they need to be investigated. Then once we have known about the early symptoms of kidney diseases, it is also prudent to know about the stages of kidney diseases. Kidney diseases have been classified by the International Kidney Disease Organizations into 5 categories. Stage 1 is very mild kidney involvement. There may be some cyst or anatomical change in the kidney, or the filtration capacity of the kidney, which we call GFR. Normally in young people it is about 120. So if it is between 90 to 120, we call stage 1. If it is more involved, between 60 to 90, it is called stage 2. In stage 3, it is between 30 to 60. And if the kidneys are getting very damaged, patient is going in stage 4, it may be between 15 to 30. You can even consider roughly percentage wise if you so wish. And if the kidneys have reached to a very advanced stage, we call it CKD 5, GFR is less than 15, and it means that the patient will require dialysis in very near future and or kidney transplant. So we have to be very careful. Kidneys are very hard working organs, but if they get hit very badly, then they remain in big trouble. It is also prudent to understand what are the causes of kidney diseases. Kidney diseases, the most important cause in today's world is diabetes mellitus. 1 out of every 2 kidney disease is due to diabetes. Then high blood pressure is the another cause. Obesity with diabetes, which we call diabesity, is another cause. Then inflammation, infections of the kidney called glomerulonephritis is the third important cause. And then sometimes obstructions due to stones, prostates, cancers cause kidney damage. Then there are familial causes of kidney diseases like polycystic kidney diseases, hereditary cystic diseases, some segmental sclerosis and other diseases which run in the families. So if somebody had a history of kidney disease or dialysis in his maternal or paternal side, they should be very, very careful. And after knowing these important causes and symptoms of the kidney diseases, we must also understand the treatment. The treatment is to control the symptoms, control blood pressure, control diabetes, and if there is anemia, control that. Then kidney diseases have a lot of bone problems, we have to control that. Finally, I would like to tell you how to manage pedal edema. As I said, pedal edema means excess of salt and water. So you must tell your patient to drink less water and take less salt, because if they take more salt like chaat, pakodi, achar, papad, these are very high salt containing items. Canned fruits are very high salt containing items. Normally fast foods have more salt in them. So if somebody is taking more salt, somebody is more thirsty, then they will take more water. So if there is pedal edema, there is excess of salt and water. Patient has to be educated to take less salt, drink less water. Number 1. Number 2, they should be told about different positions in which they think. Sometimes the edema could be due to some medicines, and sometimes the edema could also be due to idiopathic or the veins of the leg becoming little weak and not able to return the blood from the leg. So they should maintain a position in which they can keep their legs a little high and they can keep doing their exercise like moving their feet like this. So their leg can return the blood to the heart and their edema will reduce. So by intelligent use of posture, by sitting in different postures, by diet, they will be able to handle edema very well. Sometimes if there are varicose veins or dilated veins, they may need to use the tongue is slipping. Basically, you need to use stockings. Yes, so you have to sometimes use stockings or special socks to return the excess fluid to the heart. And finally, if all these things don't help, then there are medicines called diuretics which they may need to take. But they should always be taken under consultation and guidance of the doctor, of your treating doctor. You should not take it otherwise. The advantage of diuretics is it will reduce your swelling, it will reduce the excess salt, and the excess load on the heart would be gone. But the disadvantage is if somebody is not careful and the diuretics you take may bring the BP down precipitously, and patient may have a problem, he may fall, there may be syncope. So one has to be very careful. And injudicious use of diuretics can even damage your kidneys. And many other times, sometimes they call very low salt in the body, which is called hyponatremia, which can sometimes affect the brain. The patient may go in coma, encephalopathy, and so many other things which we don't need to go into. Suffice to say that if the salt restriction and water restriction is not working, the patient should need to take diuretics under guidance from his doctor to control the edema. I think I will end my talk here, and I would remind you that edema is a very important symptom of kidney disease. Kidney diseases today are becoming epidemic. 8 to 10% prevalence are there in the whole world, and diabetes, blood pressure, and indiscriminate eating and wrong medications are the cause for it. We have to keep our kidneys healthy. If we keep our kidneys healthy, his heart will be healthy and our whole body will be healthy. Thank you.